This is our quality improvement project. We focused on reducing the time frame female patients spend waiting for diagnostic mammogram results.
Breast cancer lesion uncertainty can be frightening and upsetting for patients. The time between initial detection and diagnosis can be extremely stressful. Uncertainty can increase anxiety and cause sleepless nights in women awaiting their results.
According to previous research, interventions to reduce wait times between screening and the full workup of diagnostic mammogram include improving communication of results to family physicians and assisting family physicians to create well-developed processes for access to imaging. This access can be set up with assessment centers throughout communities. Diagnostic facilities could reserve appointment times for specific patients with abnormal screenings according to previous referrals. Facilities can expedite results for those women who are at an increased risk for breast cancer. Patients who have been educated about their results and their plan of care receive better quality of care, suggesting that physicians need to spend more time educating each patient that needs a follow-up for an abnormal mammogram result. But it shows that practice environments may not always allow enough time for this patient-physician interaction. And standardizing scheduling blocks and decreasing radiologist time to protocol orders has also been shown to be effective to reduce wait times.
The goal of improvement is to decrease the number of women having sleepless nights waiting for diagnostic mammogram results. The way to achieve this is to increase the number of women receiving the results from a diagnostic mammogram within 2 days of the appointment, and to increase the number of women with a suspicious lesion that are receiving diagnostic results within 7 days.
We chose 3 lean methods. The first one was tack time. Radiologists typically do not devote specific time increments to reading diagnostic mammograms. Therefore, physicians are waiting for diagnostic results. The radiologists do not communicate directly to patients, but rather rely on the physicians to do so. So screening tests are booked months in advance, and the slots are filled, leaving fewer openings for scheduled diagnostics appointments. The second lean method we used was brainstorming. There are separate diagnostic mammogram slots from the screening appointment slots to ensure the capacity and shorten the standard for the 14-day scheduling. So there's a 14-day scheduling delay for diagnostics appointments. Physicians and patients both desire a 2-day turnaround on diagnostic appointment scheduling. The third lean method we used was root cause analysis. There's no dedicated appointments for diagnostic mammograms, standard 14-day scheduling, and no confirmation or reminder systems. Because there is no confirmation or reminder system, appointments are sometimes booked and are taken up from slots from the diagnostic appointments.
With our current value stream map, the patient must go through a lot of hoops in order to have the diagnostic mammogram performed. A large amount of time can be wasted when a patient has to be scheduled in for the mammogram to be performed. Many other factors, including time off work, availability of the hospital staff, and fear, can divert a patient from coming back to have the diagnostic mammogram performed. This large gap of time can lead to many sleepless nights for women, while also creating a sense of worry. Once the patient has had an abnormal finding on a screening mammogram, they must be referred for a diagnostic mammogram. After the diagnostic mammogram has been performed, the results are sent to the provider interprets those results, and alerts the patient of the findings while referring to an oncologist if needed.
Hi, Ms. Alvarez. I have your screening mammogram here, and it is showing some suspicious lesions, as you can see up here. And so I'm going to be sending you back to the radiologist for a diagnostic mammogram.
When should I go in? How soon will I get my results?
It all depends on how fast the radiologist can fit you in, so it could be a couple weeks.
I have Dr. Spillman's patient here. They found a suspicious lesion on her screening mammogram. I'm going to send over a referral to Dr. Spillman for her to get a diagnostic mammogram.
Hi, this is Abigail at Dr. Spillman's office. Hi, Abigail. This is Courtney Alvarez. I'm just really concerned about my diagnostic mammogram results. I was just calling to see if you had any feedback on those yet.
Okay, hi Courtney, can I have your name and date of birth, please?
Yeah, so it's Courtney Albers, Albers, and it's February 20th, 1995.
Okay, let me pull you up. I see you here, and you came in for your diagnostic mammogram, correct?
Yes.
Okay, it has not yet been reviewed by the physician, but as soon as I have those results, I will have her call you and you can come in, okay?
Okay, can you make sure she calls me because I'm really concerned about it?
Absolutely. As soon as we get those results, I will have her call you and get you in as soon as possible, okay?
Okay, thank you.
All right, bye-bye.
Hi, Ms. Albers. It's good to have you back. So we finally got those results read. How have you been since the last time that I saw you?
I just had a lot of sleepless nights over this. Just really concerned and really frazzled about getting the results back.
Yes, it has taken us quite a while to get these results back. I apologize for that. So we got the results back and we read them, and it turns out that the lesions that we saw in your mammogram, your screening, turned out to be benign. So there's nothing to worry about.
Okay. After consulting with Mrs. Kristen Bosch, a women's health nurse practitioner and lecturer at the University of Louisville School of Nursing, she stated that policies and procedures can delay mammography results. Her office follows a practice of having a standing order available to perform a diagnostic mammogram if needed. This not only cuts back time that patients have to wait to schedule the diagnostic mammogram, but if any abnormal results are found, a radiologist can interpret those results to the patient and treatment can begin right away. This rapid process can cut back on patient worry and lessen the amount of sleepless nights. Once an abnormal finding has been found on a screening mammogram, a standing order for a diagnostic mammogram is available. After the patient has had the diagnostic mammogram performed, those results are sent to the provider. The provider will interpret those results and alert the patient of the findings and refer to an oncologist if needed.
Ms. Albers, after reviewing your screening mammogram results today, we have found a suspicious lesion, so we're going to send you to get the diagnostic mammogram since we already have a standing order.
Okay, sounds good. I'm excited that you already have a standing order. That means I should get my results back quickly.
Okay, here I have the results of Ms. Adler's diagnostic mammogram. Dr. Spillman went ahead and put in a standing order, so we didn't have to wait any time at all to go ahead and get her mammogram results. I'm going to send them back to Dr. Spillman so she can share them with Ms. Albers.
Hi, Ms. Alvarez. I have your results from your diagnostic mammogram that you got at the hospital. They went ahead and did one after your screening because they found a suspicious lesion and already had standing orders in for that. So I have the results back here, and it's nothing to worry about. It was a benign lesion.
Oh wow, you got those results back really quickly.
Yes, it was very fast having those standing orders in there.